This is Dr. Siegel demonstrating an endoscopic evaluation of a gastric bypass. First, the endoscope is advanced into the mouth where you can see the larynx above, and we introduce the scope into the esophagus below. Going down the esophagus, here we approach the gastroesophageal junction, where I take some time to measure the top of the stomach relative to the diaphragm to check for hiatal hernias. The scope is then introduced into the stomach or gastric pouch, and the gastric pouch is inflated and irrigated out for a clean endoscopic evaluation. This is the anastomosis, where the small bowel is attached to the gastric pouch. I then evaluate the small bowel. The endoscope is advanced into what's called the blind limb or the candy cane limb. That is a short distance and a blind end, usually on the patient's left side. And this is cleaned out, and if there's no excessive dilation or food retention, this is considered normal. And then the scope is brought back towards the anastomosis, where, again, the small bowel is hooked up to the stomach. I check the anastomosis for signs of ulceration, and then I go down to what's called the rude limb, or the alimentary limb, the main pathway for food and digestion. The scope is advanced as far downstream as it can go, examining for strictures, bleeding, or any other sorts of pathology. Then I slowly bring the scope back to the anastomosis. I spend a lot of time checking for ulcers. The scope can be carefully retroflexed or looked backwards to the undersurface of the anastomosis or the top side of the gastric pouch right here, again to look for things such as ulcers or polyps. And then a final examination of the pouch here, again the anastomosis. Looks pretty good, slightly larger than normal anastomosis, but nothing too concerning. This is the Z-line, where the esophagus and the stomach meet. This slight bit of irregularity would be biopsied, as I do in this example, and this is to check for things such as Barrett's esophagus. And then the scope is slowly withdrawn, checking the esophagus on the way out. Thank you so much for watching this video. Please make sure to subscribe to my YouTube channel for more videos.